Which of the following approaches does not give the defined action of contraceptive? The first one is the barrier method. It prevents fertilization. This is absolutely correct. The barrier methods, which include condoms, diaphragms, work by preventing sperm from reaching the egg, thus preventing fertilization. So that means option A is an incorrect answer. B. Intrauterine devices. It increases phagocytosis of sperm, suppress sperm motility and fertilizing capacity of sperms. This is also true. Some IUDs also change the environment of the uterus to prevent implantation as well. So the second option is an incorrect answer. Option C, hormonal contraceptives. For example, the birth control pills prevent retard entry of sperm, prevent ovulation and fertilization. This is correct. They prevent ovulation, thicken cervical mucus to block sperm entry, and can also alter the uterine lining to prevent implantation, thus preventing fertilization. So the third option is also an incorrect answer. Option D, vasectomy. Vasectomy is a surgical procedure that involves the cutting or blocking the vas deferens, the tube that carries sperm from the testis to urethra. So it does not Option D, vasectomy. Vasectomy is a surgical procedure that involves cutting or blocking the vas deferens. It does not affect spermatogenesis. Option D, vasectomy prevents spermatogenesis. Vasectomy is a surgical procedure that involves cutting or blocking the vas deferens. It does not affect spermatogenesis, that is the production of sperm. After vasectomy, the sperm are still produced but are reabsorbed by the body because they cannot be ejaculated. Thus, vasectomy prevents the transport of sperm, not spermatogenesis. So, the correct answer is option D. Vasectomy is not preventing spermatogenesis, it prevents the transport of sperm.